This is the photo of a 15-year-old girl who came to neurology OPD with history of ataxia since childhood. This is known as pes cavus deformity. You can observe the increased plantar arch here. Hello everyone. I think you've seen the picture which I showed in the beginning, that this patient has got deformity of the foot in the form of increased plantar arch. I think all of you are able to identify that deformity, and this is called as pes cavus. This is slightly different from another foot deformity called equinus or equinovarus deformity. Equinus means increased plantar flexion of the foot, varus means inward tilting of the foot. So when there's a combination of equinus and varus, then we call it as equinovarus deformity. Whereas pes cavus stands for increased plantar arch of the foot. So let us see in brief about what is pes cavus and equinovarus and what are the common causes of these conditions. So pes stands for foot, cavus stands for increased plantar arch. So basically, whenever there is increased plantar arch, we call it as pes cavus. So along with increased plantar arch, there can be associated forefoot adduction and forefoot pronation. So all these things can be associated together. So what are the common causes of pes cavus? Causes can be classified into neurological causes and non-neurological causes. Under neurological causes, the two most important causes of pes cavus are Friedreich's ataxia, hereditary motor sensory neuropathy HMSN, are also called as Charcot-Marie-Tooth disease. These two should be in the frontline differential diagnosis of pes cavus. The other neurological causes of pes cavus are cerebral palsy, Huntington chorea, and motor neuron disease. Non-neurological causes of pes cavus includes traumatic like talar neck malunion, congenital like clubfoot, and if we are not able to find out the exact cause, then we call it as idiopathic. And under idiopathic, most of the time it is undiagnosed rheumatoid arthritis or diabetic foot syndrome. So this is the list of causes of clubfoot. List of causes of pes cavus deformity. Let us see what is equinovarus deformity. It's also called as talipes equinovarus, sometimes referred to as clubfoot. And this is characterized by plantar flexion. As I told, equinus means increased plantar flexion, and varus means inward tilting of the heel from the midline. And there can be associated adduction of the forefoot, that is medial deviation of the foot away from the vertical axis. Equinovarus deformity, whenever there is combination of equinus plus varus plus pes deformity, increased plantar arch, the classical differential diagnosis includes Charcot-Marie-Tooth disease. Charcot-Marie-Tooth disease or CMT has got various subtypes. CMT type 3 has got two disorders under its umbrella. One is congenital hypomyelinating neuropathy, the other one is Duchenne-Sotta's neuropathy. These are the two common CMT subtypes which are associated with equinovarus deformity or sometimes pes cavus also. So in nutshell, what I am trying to convey is that whenever there is foot deformity in the form of pes cavus or equinovarus deformity, the two neurological differentials should come to your mind. One is Friedreich's ataxia and the second one is CMT or HMSN. So under that, especially type 3 CMT, that is congenital hypomyelinating neuropathy or Duchenne-Sotta's neuropathy, should be in the differential diagnosis. But whenever the equinus deformity or pes cavus is unilateral, then the non-neurological causes of those conditions will take the priority. Like for example, trauma, diabetic foot disease, all these things will come as a frontline differential diagnosis rather than neurological cause. So remember, whenever it is bilateral foot deformity with associated neurological signs and symptoms, then think of Friedreich's ataxia and HMSN or CMT. Whenever it is unilateral, in the absence of other neurological signs and symptoms, then think of congenital clubfoot or traumatic malunion or sometimes diabetic foot disease also. So I hope this video is useful. Thank you for watching. Thank you.